What if I told you that three of the biggest health trends trending on social media nowadays could actually do you more harm than good? From raw milk to parasite cleanses to a dog dewormer being called a cancer cure. Millions of people are trying this every day. But what does the science actually say? Hello, all. I'm Dr. Neha Garg here. Let's separate fact from fiction. Myth number one: raw milk is healthier than pasteurized milk. Many influencers claim raw milk boosts immunity and preserves nutrients destroyed by pasteurization. The truth? Pasteurization removes dangerous bacteria while preserving almost all of milk's protein, calcium, and nutritional value. Raw milk can carry E. coli, salmonella, campylobacter, and listeria, making it especially risky for children, pregnant women, and older adults. Natural does not always mean safe. Myth number two: most chronic symptoms are caused by hidden parasites. If you're feeling tired, bloated, or foggy, social media may tell you that it is parasites. Products containing wormwood, black walnut, clove, laxatives, or other herbs are then marketed as solutions. While parasitic infections certainly exist in some parts of the world, they are far less common than conditions like IBS, food intolerances, anemia, thyroid disease, or even chronic stress. Proper diagnosis requires the right stool test or blood test and not just a random parasite cleanse. There is no clinical evidence to show that over-the-counter parasite cleanses help with these symptoms. They may instead cause diarrhea, dehydration, liver injury, drug interactions, and may even delay a real diagnosis of IBS, celiac disease, or even colon cancer. Myth number three: Fenbendazole cures cancer. Fenbendazole is a veterinary deworming medicine that became famous after a viral report described three cancer patients who improved while taking fenbendazole alongside other therapies. Sample size was only 3 patients with no control group, and the paper was formally retracted. Yes, there is some suggestion from lab studies that it may help slow down cancer cells in a petri dish. But till date, there is no large clinical trial showing that it actually treats cancer in humans. In fact, severe liver injury has been reported in some people taking it, and leading oncology organizations recommend against using fenbendazole outside of properly conducted clinical trials. So here's the lesson: you should not believe everything that you see online. The best medicine combines curiosity with good evidence. And that's exactly what we strive here at Healthy Buddha. If you enjoy myth-busting videos like this, then please hit that like and subscribe button and let me know which viral health claim you'd like me to examine next.